missed the very beginning, sorry. Do you have an organization or something? I mean, it seems like this is almost something that everyone needs to hear. Like, it's so simple. And
yeah, that's the thing. It's really, really simple. It's, no, I do not have an organization. I did this through a nonprofit that works in Bangladesh, and, you know, I was happy with the results, and so.
You should be mentoring other organizations.
Well, that's why I'm here.
Do you ever run into trust issues with people disclosing this information?
To me or to
whomever is delivering the survey?
Yeah, that is an issue. That's definitely an issue in any survey. Is in the directions which I cut out, but the directions go through. We're not going to share this information. This information can be used for this and this purpose. And so that is an issue in any survey. Like in Bangladesh, it's very communal and village mindset. So getting people one-on-one was difficult in and of itself because they see people talking and like the natural thing is for people to get together. And people had no problem sharing the information. But yes, that's definitely a possible problem is that people, there's an incentive that maybe someone wants to feel more popular than they are. So if people are asking them, if you're asking who do you go to for help or advice, maybe they're not saying someone, or they want more people to come to them, so they list more people who are coming to them. But yeah, those are issues. But I think it's not any issue that's greater in this type of survey versus any other sort of one-on-one type survey.
Do you ever find that the most popular person, Mr. Mida, is a negative role model?
One of the questions that we asked was also, is there anyone that you would go to for advice, except but are there reasons that you're not going? So no, that we didn't see that because maybe possibly because we had that question, but usually if you're framing the question in a positive way, usually you're going to get the positive, more positive versus the negative.
It seems like you get really a clear picture in a smaller sort of discrete group of people. Is it more difficult to do, or does it get a little confusing if you have a larger group or places that are confounded with like people using the media or people using actual institutions?
No, because you could list that. There was one group. This was only one subsection of the village. There's another part of the village where there's this nonprofit has a presence there. It's called TDH, Terede Homes. I think it's from the Netherlands. But so people were listing that. So no, it wasn't a problem. And in the directions you can say really anybody. It can be media. Media wasn't really a problem because no one has electricity or TVs. But media, radio, anything like that. So, and you can scale this really big. Like there are companies who do this for entire, GE. You have every employee in GE listed, and so you can really scale this up. This is just a small, social network now. Yeah.
I'm thinking of what the keynote Jacqueline said about the bathroom, where the one bathroom wasn't successful because it was a different tribe.
Yeah.
Maybe they should have done this before. But my question is there is this a relatively new technique? Is there research that demonstrates the efficacy of this over other ways of intervention?
I haven't seen this applied to health. This has been used to track like epidemiological things. Like there's a guy, I think he's in Denver, who does it. It's not in a lot of places. Like the schools that do this for like PhDs are usually in California, Columbia, and Harvard. And there's a guy who wrote a book called Connected, which is something about this. But it's not that it's new. It's just using it in different ways. Like the government's using it to track terrorists and things like that. So it has a lot of applications. Yeah.
I would just partially answer that because I come from a school in California that's doing this a lot. And so it's lots been done on like tobacco use, obesity, showing how social networks impact health. And just in case you don't know, there's the new program announcement from NIH on social networks and health that was just out like 2 weeks ago. So they're on it.
Actually, I would also add something to that. I work in health communications and marketing, and this kind of concept, that's kind of the basis for everything that we do. And so if you look into any kind of project that's been done anywhere in the world dealing with health or, mostly I deal with health, so that's what I can speak to, but the concept of this diffusion of innovation, that kind of thing, it's widespread within our field. So there is a lot of research about it.
One more question. Who really wants to ask a question?
I was just curious nonprofit we were working with, once you began identifying this village setting, some of the social leaders, kind of like what steps they took to mobilize them or use them as resources, what the practical implications were, if you knew any of the follow-up that happened once
The
this
follow-up is really, well, follow-up is we have to identify an issue, and that's kind of important, is to identify what issue, because it can't be too big, and we don't want it to be too trivial. So it's identifying the issue, then, getting more funding and seeing if it works. But that's going to take years, because we're talking about like we're talking about like behavioral change, things that have been done for a long, long time aren't going to change overnight.
Yeah, I'm just curious if any follow-up had been done or
Not as
council.
yet. We're in like the identifying the issue stage.
Cool, thank you so much.
Thanks. I'll be around.
So our final presenter is Jeff DeSalis. Jeff is the Global Research and Development Manager for